Hello, my dear friends. This is Dr. Suresh Shenvi here again on Aspire32. And I'm sure that many of you are looking for the updated information on the Canadian exam, that is the dental licensing exam, which has gone into a lot of changes. And recently, we did one podcast with one of my friend who was my student at KLE Dental College in Belgaum in India. And it was about the PR. But Dr. Yash has also cleared the new exam which is happening in the Canadian dental licensing exam. And today this podcast is about everything about those new exams which have been introduced in the Canada for the international dentists. So before going ahead, welcome Dr. Yash. I hope you are doing well, and I'm really looking forward to hear from you about this new exam pattern in Canada for international dental students.
Thank you, sir, for getting here. Uh, yeah, we'll share about the new exam. And
What was it called earlier, and what is it called now?
after the first two exams, that is the assessment of fundamental knowledge (AFK) and the assessment of clinical judgment, that is the second exam. The third exam was called ACS, that is assessment of clinical skills before. But then in 2022, they replaced this ACS exam with the new exam, which is called now NDECC. So this is the name of the new exam now. So NDEB is a board, that is the National Dental Examination Board of Canada. That is the board which conducts all these exams. And then
Okay.
the names are like this: AFK, ACJ, ACS.
Acha, acha. So it was AFK before, and now it is called as the NDECC exam.
No, sir. So for this equivalency process, in total, there are now around four exams. So the first exam is called AFK, that is the assessment of fundamental knowledge. The second exam is ACJ, that is the assessment of clinical judgment. And the third exam is NDCC. And NDEB is the board which is conducting all these exams.
Okay, now that's very clear. The I think it's the third exam which has changed, and the first two exams are very standard. Okay, okay. Why do you think this change was necessary, and why was this modification done in the exam?
Uh, so I guess this is the decision from NDEB. Like they must have been doing their research and their studies, and they thought that this is a good exam. Like in this exam now, there are two exams in this NDCC. So initially, before the ACS, there was only skills. Now in this exam, which is the NDCC, it's a 2 day exam. One day is regarding the skills, and the second day is the exam which is called situational judgment. So this is a new exam which was introduced. It wasn't there before. So I guess this could be one of the reasons why they changed this exam pattern.
And what's the eligibility for Canadian licensing exam? Is there any recent changes which has happened here?
To give these equivalency exams, I don't think there's any changes. It's the you just have to do. I mean, we have to be like foreign trained dentists. That is, do our bachelor's or in if there anyone is done in different countries. Except I guess it's if you've done it in US, Australia, and Ireland, then I think it's valid. Even you can practice in Canada if you have done your BDS or DDS in these countries. Except that all other countries, you have your bachelor's degree, that is the BDS, then you can appear for these exams.
I'm sure that on Aspire 32 there is a detailed podcast on this Canadian exams. But before discussing the third exam which has been modified, can we just briefly go through the first two exam, that is AFK exam? Can you give us some idea about it?
Sure, sir. So AFK basically it's a theoretical exam, MCQ based exam. When I gave, I guess there was 300 questions. It's like a 6 hour exam, 3 hours, like two sessions of 3 hours each. But I guess now it's a 200 questions exam. It's a multiple choice question exam, and it is more of theoretical. Like all these subjects we had throughout the BDS. It's and on the website of NDEB, you will find some information regarding it, what all subjects are there, and they do uh, prepare like a release question, like just as a example to go through. If anyone wants to go through it, how the exam could be like. So they do have that release questions as well, and they also publish some articles on their website which you have to go through it. So that is the first exam is basically a theoretical exam.
I remember that when I gave the US exam, we had, although we learned majority of the topics here in India, but the patient management was something which was different for, for me when I gave the US exam. Is there any subject like this which is not focused in India, and you will find that in the AFK exam in first and second paper?
Sir, AFK exam. I feel it's the same. Like it's based more of a theoretical thing. Uh, yeah, I don't feel there was any difference. It's just you have to follow certain guidelines which are followed here, and the articles and everything is going to help us to understand how things work here. But theoretical wise, like theory wise, the same standard books they have a published list of books which they follow. So that is all same.
Is there a negative marking in the NDEB AFK exam? Because in US exam, you don't get the marks. Do you get the marks in the Canadian exam?
Now when I gave, we used to get a percentile that you need to score 75 percentile. So they also used to give a score like if it's 80, 82, 85, what's your score? But now what I know is they just give pass or fail. But I think you have to get a 75 percentile. But there's no negative marking in AFK. So, but in ACJ, there's a different pattern in ACJ that they follow. That is the second exam.
Any other learning source? Do you advise students to take coaching to appear for these exams?
I would say it's a good idea to have some training institute to follow so that they can guide you as well, like how to prepare for this exam in certain like around 4 to 5 months of time you can prepare for it. And yeah, I mean you'll have to they'll also help you understand how these exams are conducted and uh, like as I mentioned regarding the articles, which is a bit different than what we do back home. So all those things, getting into training institute is definitely going to be more helpful.
So you are saying that they ask a question from recent articles. There are so many articles which will be published. How do you know which one to read?
So that's why it's a percentile based exam, right? So it all depends how everyone performs. It's not like percentage wise. So yeah, it's gonna be like they have their own measures, like how they assess.
What about the second exam? How do you prepare well for such exam?
This exam, the ACJ is assessment of clinical judgment. Basically, it's more of radiographs than patient management, medical emergencies, orthodontics, and they are mentioning the website regarding this. But the catch in this specific exam is, for example, for one question, there could be like 7 or 8 options in this specific question. So even if you select two correct option and by mistake, if you select one incorrect option, your score is going to be zero. You won't get marks for the two correct ones. So you have to be really, I mean, select an approach, be a bit more conservative or whatever you're 100% sure, you mark those options. If you feel that I'm not too sure, rather it's better to skip that option and move to the next one.
So that means the second exam, the questions will have multiple answers. And if you mark a wrong answer, it might affect your result drastically. That
Yeah,
is what you
they'll
are saying.
mention it there that select only one or select one or more for specific
Oh,
questions.
okay, okay. So if you answer it wrong, then it affects the result a lot. That is what you are saying.
Right, right.
Great. So let us assume you fail in the first exam.
Mhm.
How many days do you have to wait to again appear for the first exam again? Like in US, as far as I remember, you have to wait for 3 months if you have failed in that time when the NBD part one, part two was there. Now
Mhm.
INBD I have not read, but if you have failed part one, then you have to wait for at least 3 months. Maybe now INBD also they might say that okay, you have to wait for 3 months and then again you can appear. So is there any clause like this? Are you aware of any clause?
Yes, sir. The first two exams they conduct it twice a year. I think one is in August and the other one is in February. So there's just you have two attempts for 1 year. And in also certain scenarios, there is a chance that you gave an exam and you're waiting for your results until then, till that day, the registration for the next exam, I mean, it has closed. So even that can happen as well.
So it's sometimes it is difficult to get the slot, and it is only conducted two year in once, twice in a year. Unlike US, where it is conducted throughout the year. That is what is the major difference in Canada.
For the first
Okay.
two exams, it's twice a year, but for this NDCC, the third exam, they conduct it throughout the year. And they on the calendar, it's mentioned the specific deadlines and dates for registration. But even you have to be really, it's fraction of seconds. You have to be really quick at that moment to get a seat, or else you might have to wait for another couple of
Another.
months till the next date is open.
Okay. So that means a lot of people are appearing for exam,
Yes, sir.
and there is no need of PR to appear for this exam, right? You don't have to have a PR to apply for this.
For the exams, you don't need it, but I think to practice, for sure, you need your PR.
Practice in a sense like dental. You if you want to
Yes, yes.
practice
So if you want
dentist.
to practice a dentist by appearing the exams, you can give it, even if you're not a PR, you can give it.
So this third exam, I think that is the focus, which I think we can discuss in bit detail. Is that once you clear the first and second exam, you will have to appear for the third exam. Do you have to
Mhm.
apply? Like, are these all linked on a centralized process that it already knows when you apply? It already knows that you have cleared the first exam, second exam, or you have to take the result of the first and second, apply it offline, or is it all internet, which is streamlined, organized very well, all with the computerized system?
Yes, sir, on the NDB website, it's all there. Once you log in your profile, it'll all show you. It'll show your AFK results, your ECJ results, and only if you clear it, only then you can get an option to register for the next exam. Until then, they won't even show you the option of registering for the next one.
And what is the exam about? Like, if you are aware that what was different before and what is different now in this exam, how difficult it is to appear for the maybe perform in this exam, can you give us some information?
So you're asking about the ACS, which was there before, and this NDCC.
Yeah.
So yes, sir, I haven't given ACS, but the ACS before it was also a 2-day exam, and then I'm not too sure, but I think there were around 10 to 11 projects. I could be wrong about that. And it was a 2-day exam. And at that time, there were different locations all over Canada in different universities. There were different centers where you have to go and appear for that exam. And then you used to have 3 attempts for ACS. Even for AFK ACJ, it's 3 attempts you have. And with the ACS also, they had 3 attempts. And one more thing was, if for example, in the skills, if you fail a project, they used to give reason that what was wrong in that project, and then you can also go to the center and uh, appeal that I want to get it like reassessed. So you can also go and see what you had done, what mistake was there, and that was one of the changes. And also, I'm not too sure the total number of projects, if it is around 11 or 10 or 12, but even there was a criteria. Even if you don't, if even if you fail one or two among them, or maybe one among them, it was still okay if the other projects were all in A category, A grade, something like that. So, but now in this exam, as we compare, it's a 2-day exam again, but it's a different scenario now. One is a skills, and which is a full 8 hours full day exam, and the second day is a situation judgment, which is a half day exam. Then now, within span of 5 years, once you have completed your ACJ, that is your second exam, after that, within 5 years, there are multiple attempts you can give. But as I said, getting a date is also a challenge. But it's not like 3 attempts. You can give more than three as well if you're able to get a seat. But also a major difference is now they don't give you a reason like which project. I mean, they give which project you failed, but they don't give you the reason why you failed. And also, you cannot go and see your typodent that what was wrong, or which section or which criteria you failed. That they don't tell us anymore. So those are some of the changes which are in this new exam.
So projects, when you say projects, it means like an assignment, like a class to carry preparation or a crown preparation, something like this.
Yes, sir. So in total, for that full 8 hours exam, there are 7 projects which are supposed to be done. One is your class 2 amalgam preparation, that is a MOD. Then class 2 amalgam restoration. Then you have a class 2 composite restoration. Then you have class 4 composite restoration. Then you have crown preparation. And then you make a provisional on that same crown preparation. And then there is an endo access cavity preparation, which you have to do. And the eighth component is the infection control, which you have to follow the whole day while you are performing these 7 projects. So in total, there are 8 of them, and you have to clear all this. You have to pass all the 8 of them to clear the skills component.
So quite a hectic day. And do you think when you clear undergraduation in India, are you well versed? Do you have this competency to appear for this exam, or you really need to improve your work by some assistance or practicing?
So definitely you require more training. It's a different approach for this exam as we used to do back home. You need a lot more accuracy, a lot more training, time management, because you don't have time. I mean, there are only 8 hours, and then you have to also learn the stress management. Like for example, if you're doing a class 2 amalgam restoration, and there's open contact, and then you're running, like you need to also look at the time, like how much time you have. So you have to correct as like there's no time to even stress about it. Just keep your mind focused there, try to correct that, and then move on to the next project. Because as I said, the time is, and once you go to that center, the stress of the exam is different. There are invigilators there, and then I mean, there's a clock which is sitting right in front of you in the screen. And yeah, those 8 hours you have to be really focused. So you need a good amount of training for sure.
And how do you get that training? Do you, uh, again, joining a coaching center? Is that your recommendation?
Yes, sir, definitely, because it depends. If you want to practice at home, you can also do that. But I would really recommend to get to go to a training institute. So at least there's someone else who is assessing your work, and they can give their feedback, which is really important. Tips and tricks, how to correct things, how to be. If the main thing is there will be some error which will happen. Like even if you practice 100, you do 100 count reps. I mean, there are chances something can happen at that day. So you should be really. It's more about training, time management, how to solve if there's anything going, if there's any error, how to correct it as soon as possible, and also how to fit into the criteria. They have given the criteria on the website, so it's also more about you don't have to be like beautiful work. Of course it has to meet the standard which they want, which is all mentioned in the criteria. But you have to know that okay, I think this is within all the criteria. It's okay. I'm just gonna finish this project and go to the next one.
No, that's a very nice thing because when during when I was a student, I used to read the whole student, and we don't know what is the important aspect of from it unless our teacher has told us. The standard is the same. Like when you do a class two, I'm sure that they would check clearance, they would check the
Mhm.
depth, axial depth.
Right.
So we have also made the checklist, which basically tells all those things. But many times, what happens, the student doesn't understand, and again, after clearing, they have to go through the same process because they don't understand that basically these are the criteria which you have to evaluate. But of course, many times we learn with our own experience and mistakes. But as you said, basically it doesn't have to look beautiful, but it has to meet the criteria. That's a very nice thing which you have mentioned. And all these examiners are from the center, and they will not give you any feedback, right? You just submit it, and they will evaluate, and you get the result. So
Yes, sir.
each project will have grading like A plus, A double plus, A or A, B, C, and you have to always get A in everything, or okay, one project A, some project was B plus plus, or what was, do you think is the passing criteria, like A in everything?
No, sir. So here in the website itself, they have mentioned like there are three categories. One is I think completely fully competent. Then there is minimally competent, and then it is not competent. So minimally competent is the second category, which is like there could be some errors, but it is still clinically acceptable and it meets the standard which they want. So even if you fit into that competent for all these 7 projects, that's okay. But even if one of them it's not competent, then you have to repeat the whole exam again. It's not like you're gonna repeat the specific project, but you have to
Oh,
do all the seven
ach-
projects again.
oh, that's very, very scary because of one project you have
True.
lost it's not like okay, char, you had four subject here and you flunked in one subject, so you have to appear for one subject. You have to appear for all four subjects.
And the thing is,
Oh,
next time you can
make
create some mess
mistake,
in
it's
the
yeah,
other project. Yeah, yeah.
yeah, that is
So
always there. You might perform well in the project where you have
which you
failed
failed
last
before.
time,
Mhm.
but in the project we had performed better, you may have done it wrong. That's
True.
okay.
And
Then
also
I
the
think,
reason, like if you have a reason why you failed, so that okay, I have to be careful with this one next
but
time.
now
That
you don't
this
have
was
it. Now you don't know why you have failed.
yeah. Sometimes you know it. If you know that there's a big error and you fail that
You
project,
have,
then
so
you know that
sometimes
okay,
you know the error.
yeah. Sometimes in that moment you feel no, this was okay. I think, and that's why I moved to the next one. Everything was okay in this one, but then you
Mhm.
end up failing the project. There could be something wrong, but at that moment maybe you don't
We may
realize.
not
Okay,
realize it. Okay. I have heard that people have to carry typho, aerator, compressor. Few years back, people used to tell me that, that I see that people post sale of this, all those materials. Do you still have to carry it now, or do the exam center provide you this?
so now you just have to carry your loops and what you want to eat for that break time, which like no one eats usually, but yeah, you just have to carry something if you want to eat uh, in that lunch break, and only the loops. That's it.
Can you
Everything
can
else they will.
you can you give the exam without loops, or loops are compulsory?
No, no, no. You can give without loops. It's up to you.
Ah,
It's not like mandatory.
okay. No, loops, always using loops is beneficial. We have introduced loop from second BDS in our institute. Of course, there are few colleges which do, but suddenly for someone after coming out using loop on the exam day would be difficult. I think the student has to be trained from early days. But of course, that can always be practiced. How much is the fees for if you know the individual exam? or overall, if you can give us the expense of the exam currently.
For the NDCC, it's $7,000 for the whole exam. And for example, if you fail one among them, then you have to pay 3,500 to appear for the exam again. That is for this specific exam.
$7,000 means how much in Indian rupees?
Let's see, like 60 rupees, so around 4,20,000 rupees.
4,20,000 rupees
Yeah.
of one exam. And what about the earlier exams?
I guess for the registration of NDEB, it's around $1,000. That rupees. Then again, if I'm not wrong, even for the first two exams, it's around $1,000 for both of them, maybe 1,100, 1,200, something like that. That is again around 60, 70,000 rupees each.
So overall, how much a person would spend? Is it like 6-7 lakh rupees?
Uh, if you, for example, for this NDCC exam, if you're appearing for the exam for the first time, you $7,000 is for your exam fees. Then you get your loops, that is around $2,500. Then you have to buy all the material, typhoid handpiece, all the material which you're going to use. A lot of teeth will be required.
For
Then if
practicing.
you
This is for
for
practicing, right?
practicing, for
Okay.
practicing, yeah. Then you also have to, if you're going to training institute, their fees is also, for example, if 6 months, if you're going for training for your skills, so that's on an average, it's around $10,000 for the training institute. And then also you don't have to forget the situational judgment component, which is also there. And if you're also going for any training institute for that, I would say it's around 30,000, $30,000 to $25,000, around that much expense you would look for this exam if you're going to the training institute and if you're giving the exam for the first time.
So that would be 18-20 lakh rupees.
Right, sir.
20 lakh rupees is the expense. This doesn't include
It,
your
Mhm.
stay, your expenses, your travel. So if
Right.
you have PR, you can simultaneously work and cover these expenses. Like, do you think based on hourly earning what you can get in Canada with just a PR and doing some other job, do you think can it support all these exams?
You can, like, what you can do is you can work for maybe 6 months, 7 months, work full time, and then depending on what type of work you are doing, uh, it's not easy to save that much money, but at least you can save a certain amount. And while doing the exams, it's not possible that you work and then you also appear for the exam. So either you can do it like you work for 6 months, 8 months, or a year full time. You can save some money and then go for these exams. Or else, as I said, like in our like there's a bank, CIBC Bank, which does provide a line of credit for all the permanent residents to appear for these exams. So you
Great.
can use that help as well.
So that way, this thing about loan, I think we discussed in our last podcast, which was posted a month ago. The link will
Mhm.
be in the description. So approximately, what do you think? How much time people generally take to clear all these exams? Do you think the majority crowd clears the exam in first attempt, or no? The majority chunk definitely requires in some exam more than one attempt.
So this is a tough one. This is everyone works hard for it, but it's all individual's journey. Some of them they can finish it in maybe 1.5, 2 years if you clear all the exams in the first attempt. There are many of us who also take some more time, maybe 3 years, 4 years. Like we
What is the
don't get the.
longest time you have heard? And what is the shortest time you have heard in your circle?
So it could range from maybe 2 to 5 years, from 2 years to maybe 5 years,
Do you
even
know
more. It can be more
people?
than that.
So two is the minimum according to you, which you have come across, and 5 years is the maximum. Have you heard people trying everything and leaving and going back to their country because they are not able to do it? Do you have such news?
I have, I mean, I have heard a few stories like they do maybe hygiene, or they turn their career into something else, or they try for the US exams, because it's not easy for everyone to keep on appearing for these exams, because there's also personal life involved, and these exams are expensive as well. And then, yeah, different individuals have different life responsibilities, situation. So some of them they take some break, maybe do some other work till then, and then once they have a stability, then again they try for the exam.
And how long does it take to get the results after you appear for the exam? They release it in 15 days, 1 month, 2 months?
It's usually at least 1.5 months. Depends. Like for example, the exams are happening in October and November, and I have given my exam in October. You are giving it in November, so the results are expected in mid-January, something like that. At least 1.5 months. You should consider to 2 months.
So, Dr. Yash, you have been mentioning about this another important thing, that is the situational judgment. What is it about?
So this exam, the situational judgment, is the half-day exam, which is the other component of this NDECC. So in this exam, there will be 10 questions. There are five subjects, five topics, which are patient-centered care, professionalism, practice information management, communication and collaboration, and health promotion. So there will be 10 questions in total, two questions from each topic, from each of these five topics. Now, the trick here is to pass this exam, you have to score 6 out of 10. That is the minimum which you need. But out of these six which are correct, from each of the topic, at least you should get one question right. So there could be a case if you score 8 out of 10, but the two questions which are wrong, this could be from one specific topic out of these five. So if the two questions are wrong, you have to repeat the whole exam again.
And you have to clear both the first day and second day, only then you will be considered as the pass in this new pattern of exam, right? I mean,
Yes,
let us
doctor.
assume
Mhm.
in the second day exam, you failed, but in the first exam you have cleared. Do you have to again appear for the first day exam and second day exam, or you can only appear second day exam in the second attempt?
So for the first attempt, when you give, you have to give both the exams together.
Right.
But if you pass the skills component, you don't have to repeat the skills component again. You just have to repeat the situational judgment component again, and vice versa.
Nice. So that is at least beneficial. Now, there are two things which are very clear. One, what you said is the first day, in the first day, you have those projects. And
Mhm.
suppose even one projects go wrong and you are below the minimum criteria, you have to appear for all the projects again, right?
Right.
And if you have cleared the first day exam, skill
Mhm.
component, that is 10 projects very well, but in the second day, situational judgment, you failed. In the second attempt, you just have to appear for the situational judgment, and the fees would be $3,500, which generally would be around 7,000 for the first attempt.
Right. Right. Right.
Okay, now that's very clear. Let us assume you cleared all these exams. You also mentioned that there is a last exam, which is the board exam. Can you give us some information about what is this board exam about?
So this exam is the OSCE exam. This is the final step in the equivalency process. And this exam, even the graduates who are studying here in universities, in different universities of Canada, even they have to appear for this exam to finally get the license. This exam is not that challenging as compared to the AFK, ACJ, NDCC. This OSCE exam, it has a good passing rate, and anyone can check out the passing rate for all the different exams on the NDB website. They have mentioned, if you just go the historical passing rates, they mentioned the passing rate for all these exams.
So that's a good news. And I think with all the difficult exams, this exam would definitely appear a bit simpler. And what is the exam fees for this fourth exam? Is it, have you included already in the
Mm.
thing which we discussed?
No, no, no. This is the separate fees. I'm not too sure. I think it's maybe $1,500 or $2,000. Just have to check on the website.
$2,000 also means it is in lakhs.
One,
I think let us assume
but
1.5 lakh
mhm,
rupees.
right. But
Okay.
after all these exams, and you know that this is just a final step, and you will
Okay.
be working. You'll be getting a license soon. So this main
Mhm.
struggle, real struggle, is still to finish this till NDCC.
So I think we have pretty much covered everything. I'm sure that if people want some other information, they would mention in the comment section. But what will be your top five advice for people who are appearing for this exam? Like if you go back in time, how would you do it differently?
For this specific exam, like NDCC, I would say the most important thing is try to beat stress because it's not easy. You have to go there for, like, for example, you're going there for the first attempt, you preparing for 6 months. You go to your classes 8 hours in a day, and then you have to also prepare for the situation judgment exam. And you're just going there, practicing the same projects, same. I mean, just looking at the team, doing different, making different errors. So patience is very important. You need to be really patient throughout these few months which you're preparing. Stress management is very important because you just feel like, I mean, what's going to happen in the exam? What if I fail? What if this goes wrong? All those things are there, but you just trust the process. Do your hard work and then leave the rest. What you can do at the end of the exam day, you should just ask yourself that, was there anything else I would have done? If you think you have given your best, that's it. Then whatever happens, if you pass, great. If you don't, it's okay. Take a break. Don't give up. Start again. And for sure, I mean, I've seen there are people, even I took some more time to clear these exams. So maybe it can take some more time, but if you don't give up, for sure, you will be there. So yeah, just be patient.